Thank you for joining today's Nile webinar. This is Lisa, the Education Manager with Immunize Nevada, and I will be today's moderator. Before we get started, I'd like to review a couple of housekeeping items. Please first locate the chat box in the bottom left corner of your screen. If you have any questions, type them into the chat box and we will address those questions at the end of the presentation. Secondly, if you have requested nursing or pharmacy continuing education credit for today's webinar, please make sure you complete the survey in the post-webinar email. The email will be sent out by the end of today, and all CEUs will be emailed out within the next week. A little disclaimer, Immunize Nevada's Nile webinars are made possible by the generosity of speakers who donate their time and expertise to benefit the coalition. The expectation and goal is for community partners to gain knowledge on immunization-related topics through a non-branded, unbiased presentation. I'd now like to turn it over to our speaker, Christy Ziganis, who is the Adult Immunization Coordinator for the state of Nevada. Christy grew up in California, where she received a degree in psychology from Sonoma State University before she went on to get her graduate degree, a master's degree in counseling. In February of 2017, Christy was warmly received into the healthcare field as the Adult Immunization Coordinator for the state of Nevada. So also happy one-year work anniversary, Christy, and with that, I'll let you take it away.
Thank you for that, Lisa. I really appreciate that, and welcome everybody who's joining us today. We'll just get started here. I was hired on nearly a year ago to the Nevada State Immunization Program. There's a grant funding open, a grant position open for the Adult Immunization Coordinator. So we'll just keep going here. Okay, adult vaccination rates in the United States are very much below the Healthy People 2020 goals, and there are definitely racial and ethnic disparities across the board. Nevada is no stranger to that. We also have rates that reflect similar disparities in low vaccination rates statewide. Just to give you an idea about the landscape, here's national rates for flu in the 16-17 season. We're about just barely over 43% coverage rate for adults 18 and up. For pneumococcal, it was 66.9% for 65 and up. Tdap was 28% for 19 to 64. And the zoster came in at just over 33% for individuals 60 and over. Okay. Here's Nevada's landscape. We're a little bit below some of these national levels and, of course, well below the Healthy People 2020 goals that have been set. For our 16-17 flu season, we were just above 33% for 18 and up. Pneumococcal coverage rate was at a 65.9. Tdap was 36.4 for 19 and up, and zoster was only at a 21.5% for 64 and up. So what we've learned through this project and gathering information to move this project forward are the barriers to adult vaccinating. And of course, one of the top ones is limited patient awareness that they need it after childhood. It's just been across the board messages of most people know that you need them for childhood, but not beyond that. Another barrier is financial burden of the patient for any out-of-pocket expenses, which the ACA did help to eliminate some of those, but definitely not for the Medicare recipients or some of the Medicaid also out-of-pocket, I believe. There's limited incorporation of the vaccine assessment into routine patient care by adult providers. Part of this is also because adult patients generally have different providers that they see for various specialties, and so who does it fall on? There's also limited or incorrect use of the State Immunization Information System, which is WebIZ for our state. Either they're not getting documented into WebIZ, or there's issues along the way with the technology. And then lastly, the financial burden on the provider side for inadequate reimbursement rates. So it's not very cost efficient in some of the cases. These are just a handful. This definitely doesn't cover all barriers. Okay, so for WebIZ, that's our statewide IIS, which is Immunization Information System. One of the best tools that Nevada has to support immunization is our database and collecting that. IISs are in every state and territory in the U.S. and in many countries throughout the world. They are confidential, population-based databases that consolidate and store a person's immunization history. State law requires that all doses administered in Nevada be reported unless the patient signs a form to opt out. This data is then readily accessible to immunizing providers, facilitating informed clinical decisions. It's also available to organizations that need to verify immunity, such as insurers, schools, daycares, centers, etc. In addition to looking at this data in aggregate to identify Nevada populations that may be vulnerable to vaccine-preventable diseases, the Nevada State Immunization Program uses this system to facilitate publicly funded vaccine orders, and to conduct coverage assessments on those providers receiving said vaccines. In many ways, Nevada WebIZ is the hub of the Nevada State Immunization Program activities, because it does gather all the information. However, when it comes to supporting the adult vaccine world, it certainly has some room to grow. Okay. Now, I touched on some barriers before, but let's talk about it as it applies to WebIZ. There is a persistent concept of vaccines being mainly for children that carries over to a lot of provider messages, and that it's kind of just now shifting that adult vaccines are just as important. Many providers are surprised to learn that the IIS is a law, that the IIS law requires adult vaccinations to be entered into the system. And there's always a mindset of some older individuals, Nevadans, who have a distrust of science or technology or the government, and they just don't want their information given out or stored in a government database. As do most, if not all IIS, Nevada WebIZ uses the concept of a patient roster to help providers and program staff monitor and increase immunization coverage. This is especially helpful in pediatric settings where children must return for multiple vaccine doses to achieve immunity, and do so on a regular schedule at relatively short intervals. The patient roster supports the generation of reminder and recall lists leading to phone or postcard notices, but that's only, of course, if your roster is kept current and accurate of a representation of your patient population. Healthy adults visit doctors far less frequently and are typically recommended for fewer immunizations than children. They also tend to visit a variety of providers, which I touched on before, especially for immunizations, and that in large has to do with the Medicare coverage of where you can be vaccinated for which vaccines. For example, flu can be covered at the pharmacy rather than your primary care. There is a little bit of a less engagement. There's less known about the patient at the adult level just because they're not as consistent in timing of going to their provider. I hear a lot of, I had no idea they moved or died or started seeing another doctor. And so that's where the patient roster in regards to the adult population kind of sees some troubles. Throughout IIS's over 25-year evolution, much of the functionality was developed with a focus on childhood immunizations, and we're now starting to shift that to look at how we can make it support adult vaccines. So let's talk about some solutions. This program is a start. It's temporary. This position is temporary. However, the efforts that I'm putting out there hopefully are sustainable. But even just bringing adult immunizations under the microscope is going to help overall. There are a lot of good resources available, for example, on the Immunization Action Coalition's website to help providers learn strategic ways to talk to patients, to give them messaging and specific verbiage, kind of presenting it as a routine medical procedure rather than an option to be considered. And that really makes a huge difference. That provider recommendation is one of the main components of whether or not an individual will become vaccinated. And while we regularly offer opportunities to end Nevada WebIZ user training, we're working on developed training videos that can be viewed independently and that have a narrow focus on certain aspects of data quality, such as the importance of complete, timely records and managing patient rosters. We can improve reporting through our ongoing work to establish HL7 connections. And what that is a software that talks from a provider's EMR to the state IIS database without an individual having to do direct entry into the database. Currently, over 400 locations serving adults report immunization data electronically, and this is the interface I'm talking of, the HL7. Of those, 81 have a bidirectional interface, meaning that they can also query the IIS to seek immunization histories and recommendations. This can also be stored automatically into the EHR and can add to the completeness of their patient records. The bidirectional exchange improves the viability of WebIZ and EHRs, and recommendations returning to the provider serve as a reminder that vaccines are a lifelong journey, of course. And lastly, the IIS leaders are beginning to focus on the need to support adults and plan to incorporate this concept into the CDC's National IIS Strategic Plan. And hopefully soon it will move towards supporting adult vaccines a little bit better. Okay, so I'm going to touch on the program that I'm working on. This is a grant through the CDC, and this is all based on the National Vaccine Advisory Committee, the call they put out a couple years ago to all providers. And these are the standards to go by. And this ARID is the acronym for it, and it's assess every patient at every encounter to see what they need or what they've had, recommending what's currently due for them, administering or referring out if they are not a vaccinating provider, and then making sure that documentation gets into WebIZ either via their EHR or direct entry. So the goal, the overall goal, of course, is to increase adult vaccines statewide. And the whole objective is to do this by establishing partnerships that will be sustainable and lead to ongoing efforts. So my efforts here for this project are implementing the standards for the Adult Immunization Practice. Additionally, I'm looking at how to expand access to Section 317 vaccines, which are similar to VFC Vaccines for Children program, in the sense that they are available to adults 19 and up who are uninsured or underinsured. And lastly, I'm working on increasing the public's awareness of the need for the adult vaccine. And with this overall objective, there's 4 project components. One is the Adult Immunization Task Force. Another is a consumer awareness campaign. Third is Section 317 vaccines. And lastly is provider education. And I'll go into detail on each of these in the next few slides. Okay, well, let's talk about the Adult Immunization Task Force. The purpose is to help steer decisions regarding consumer and provider awareness and identify and address the barriers in the adult immunization world. The task force meets monthly, 1 meeting in Reno and 1 meeting in Las Vegas, quarterly in Elko, and then quarterly via teleconference. And with this, it's just an arena for stakeholders, immunization stakeholders in Nevada to talk about hot topics and barriers and how to overcome them. The consumer awareness campaign was all in part due to Immunize Nevada, who is one of our big partners. And this is just a sample that I took from them of all of the arenas that they targeted in their consumer awareness campaign, just various forms of media and how far they got with it. It actually turned out to be quite a big bang for the buck on how many people they could reach through the various media outlets. Section 317 vaccines, it's federally funded dollars that trickle down through the state, and they're divvied out to providers who can vaccinate uninsured individuals. And a majority of the people who carry the 317 vaccines are comprised of federally qualified health centers, rural community health nursing clinics, and local health jurisdictions. There's a couple nonprofits in there as well, but for the most part, it's these that are listed. Another part of this project in making sure those 317 vaccines get into the arms of the eligible individuals, we have collaborated with Southern Nevada Health District, and they have hired an adult immunization outreach coordinator down there. And basically, it's a public health nurse who's physically going out to do the vaccines. There's various clinics that they hold or events that they go to get the 317 administered. So far for the program, Nevada has added MMR and the varicella to the available 317 funded vaccine at the request of a local health district, and that was due to an increasing demand from an immigrant and refugee population. The Adult Immunization Coordinator, that's me, is working very closely with the vaccine manager here at the state to ensure the proper use of the 317 funded vaccines, as well as to help provide some feedback for formulating future spend plans for that money. A majority of the Nevada Health Centers, they are all FQHCs, have enrolled to receive 317 funded vaccines since the onset of the Adult Improvement Project. And from February 2016 through June 2017, the Southern Nevada Health District's outreach nurse has completed 34 clinics, 1,104 doses administered to 704 patients. And that, to me, is impressive and mind-blowing, because that is a lot of unvaccinated people that are now covered, and it strengthens their community. In April of last year, Southern Nevada Health District also participated in a mobile healthcare collaborative where various entities who had mobile health vans met at a lower socioeconomic neighborhood to offer services to the population that resides there. Word has it that since last April, Southern Nevada Health District has acquired their own mobile health van, and so they're able to go out on their own a little more. And then lastly, with the 317, through this project, Southern Nevada Health District has also pushed and signed an MOU with the Mexican consulate in Southern Nevada to provide the monthly vaccine clinics offering the 317 vaccines. Another component to the project that I've already touched on is provider education. And this includes a pre and post project survey of the knowledge, attitudes, beliefs, and behaviors of providers around adult vaccines. It also includes an adult immunization toolkit that the adult task force helped create, and I hand out at site visits, and is also available to download online. Part of the adult education process, or the provider education process, is completing AFIX type models, and those AFIX is specific to the VFC program. And so this is a model, it's modeled after that, but directed at adult providers. And of course, continuing education opportunities, lots of wonderful webinars such as this. So as of right now, the status is that the pre-project survey is complete, and the post will be determined shortly here. Toolkits are being distributed at provider visits, and initial and follow-up AFIX visits are occurring. Here's a little more information for that AFIX model visit. And so the overall is to assess feedback, incentives, and exchange is kind of the acronym for that. And so when I go and I meet with a provider, we talk about the overall process of what I'm there to do, and then move on to talking about the standards for immunization practice, which is the assess, recommend, administer, and document. I then move on to discuss the importance of adult immunization, giving them the Nevada rates, Healthy People 2020 targets, and what national focus is currently happening. And then shortly after that, I give them a report card of their current rates based off of a WebIZ query. The provider and I then will sit down and go over a questionnaire, and it has a section for each of those standards. So there's a section that asks questions on assessing, on how well they do assessing, kind of like a little self-report card. But from there, we choose QI strategies, little things they can tweak in their workflow to hopefully boost vaccine rates within their clinic. And then I go back for a follow-up visit after 6 months to see how it's gone and offer any additional resources. Here is a link to the provider toolkit that Immunize Nevada and the Adult Task Force created and that I help to distribute at each site visit. I've also added a link for a flu toolkit that was recently posted on Immunize Nevada's website. So thus far, these are the providers who have participated in site visits. It's just a breakdown of the types. As you can see, the large majority there, well actually it's tied between a large health system and FQHCs. I will say the large health system, there's really only 3 entities I'm working with. It's just such a large chunk because one of the large health systems has 11 different sites under them that I'm working with. And the other includes a nonprofit, some adult mental health, and a couple private providers. So of these participants, these are the selected QI strategies. As you can see, a majority have picked to clean up their patient roster because that's generally almost an immediate boost oftentimes, unless it takes down their data sample so small sometimes it goes the other way. The next largest is to create and put into policy a process for assessing every patient's vaccination status. I am hearing that's a little more difficult depending on the practice and how much time they have for pre-planning visits. I did have a little note there. There's a light blue and a purple and it looks like 21. That's a 2 and a 1. So just a little caveat. So what's next for this program? Of course, I will be continuing initial and follow-up provider site visits statewide. Of course, continuing to fine-tune Nevada WebIZ in relation to adult immunizations. I've found a lot of hiccups along the way that I'm sharing with the WebIZ manager so that they're addressed accordingly. Continuing to work with providers to implement sustainable changes is what we're looking for. Since this program does have an end date, all of the efforts I'm trying to do really are focusing on sustainability. I will be continuing collaboration with Immunize Nevada and the Adult Task Force and of course their public awareness campaign, and also continuing collaboration with the Southern Nevada Health District to provide those 317 funded vaccines. All of these activities will be completed at the end of September. So that's the gist. This is my contact information, and now I'm open for questions.
Okay, great. Thank you so much, Christy. And before we say goodbye, we'd like to offer a little bit more time for last-minute questions. So please type those questions into the chat box now. And while we are waiting for those questions to be typed in, just a couple of reminders. If you have requested nursing or pharmacy and continuing education credits for today's webinar, please make sure you complete the survey in the post-webinar email. The email will be sent out by the end of today, and all CEUs will be emailed out within the next week. If you'd like to view or share this webinar, the recording will be available on our website along with information for future webinars. Please visit immunizenevada.org/webinars for those details. All right, and we will give everyone just a second to write some questions in if they have them. It looks like we have a question that says, can you expand on QI strategies for improving WebIZ data entry or other resources that you know
of? Absolutely. There are, we have just really good trainers on board right now. So of course the training, refresher courses are always great. One of the things, of course it depends if you're HL7 or direct entry, and they kind of have different realms. But really making sure that that patient's name is correct spelling, and that the demographics are captured on the correct line, that their date of birth is correct, those types of things. I don't know if I explained that enough, but
it's okay. If we have any follow-up questions, we can definitely connect them in your email addresses right there too. That could definitely help. Okay. Oh, they said in terms of compliance, flow of office, etc. or flow of clinics?
Okay. Well, the best that I've seen so far is to convert to an HL7 interface, because then you're only putting it once into your EMR, and the system will pull it all over electronically, so that you're not doing direct entry into WebIZ. And if that's not an option, just making sure that all your I's are dotted and your T's are crossed for that demographic information, and making sure that you get the vaccine information in correctly is in regards to administration and lot number and manufacturer and that good stuff.
Okay. All right. Again, everyone will have an opportunity to write in some more questions on the this webinar survey, post-webinar survey. If you'd like to do that as well, we can connect you with Christy. All right, and that concludes today's Nile webinar. And again, thank you, Christy, and those of you who participated. Have a great day, everybody.
Thank you.